Healthtips.tv Foundation. Please like, share and subscribe.
How smoking affects your body. Every cigarette you smoke is harmful. Smoking is the biggest cause of preventable deaths in England, accounting for nearly 80,000 deaths each year. 1 in 2 smokers will die from a smoking-related disease. Brain: if you smoke, you are more likely to have a stroke than someone who doesn't smoke. In fact, smoking increases your risk of having a stroke by at least 50%, which can cause brain damage and death. And, by smoking, you double your risk of dying from a stroke. One way that smoking can increase your risk of a stroke is by increasing your chances of developing a brain aneurysm. This is a bulge in a blood vessel caused by a weakness in the blood vessel wall. This can rupture or burst, which will lead to an extremely serious condition known as a subarachnoid hemorrhage, which is a type of stroke, and can cause extensive brain damage and death. The good news is that within 2 years of stopping smoking, your risk of stroke is reduced to half that of a smoker, and within 5 years it will be the same as a non-smoker. Lungs: your lungs can be very badly affected by smoking. Coughs, colds, wheezing and asthma are just the start. Smoking can cause fatal diseases such as pneumonia, emphysema and lung cancer. Smoking causes 84% of deaths from lung cancer and 83% of deaths from chronic obstructive pulmonary disease (COPD). COPD, a progressive and debilitating disease, is the name for a collection of lung diseases including chronic bronchitis and emphysema. People with COPD have difficulties breathing, primarily due to the narrowing of their airways and destruction of lung tissue. Typical symptoms of COPD include increasing breathlessness when active, a persistent cough with phlegm and frequent chest infections. Whilst the early signs of COPD can often be dismissed as a smoker's cough, if people continue smoking and the condition worsens, it can greatly impact on their quality of life. You can slow down the progression of the disease, and stopping smoking is the most effective way to do this. Mouth and throat: smoking causes unattractive problems such as bad breath and stained teeth, and can also cause gum disease and damage your sense of taste. The most serious damage smoking causes in your mouth and throat is an increased risk of cancer in your lips, tongue, throat, voice box and gullet esophagus. More than 93% of oropharyngeal cancers, cancer in part of the throat, are caused by smoking. The good news is that when you stop using tobacco, even after many years of use, you can greatly reduce your risk of developing head and neck cancer. Once you've been smoke-free for 20 years, your risk of head and neck cancer is reduced to that of a non-smoker. Reproduction and fertility: smoking can cause male impotence, as it damages the blood vessels that supply blood to the penis. It can also damage sperm, reduce sperm count and cause testicular cancer. Up to 120,000 men from the UK in their 20s and 30s are impotent as a direct result of smoking, and men who smoke have a lower sperm count than those who are non-smokers. For women, smoking can reduce fertility. One study found that smokers were over 3 times more likely than non-smokers to have taken more than 1 year to conceive. The study estimated that the fertility of smoking women was 72% that of non-smokers. Smoking also increases your risk of cervical cancer. People who smoke are less able to get rid of the HPV infection from the body, which can develop into cancer. Smoking while you are pregnant can lead to miscarriage, premature birth, stillbirth and illness, and it increases the risk of cot death by at least 25%. How smoking and nicotine damage your body. You probably know about the relationship between smoking and lung cancer, but did you know smoking is also linked to heart disease, stroke and other chronic diseases? Smoking can increase your risk for cancer of the bladder, throat, mouth, kidneys, cervix and pancreas. Thinking about quitting? Look at the facts. Why should you quit? Smoking is the most preventable cause of death in the United States. Almost 1/3 of deaths from coronary heart disease are due to smoking and second-hand smoke. Smoking is linked to about 90% of lung cancer cases in the United States. Smoking rates overall are down, but too many adults still smoke, vape and use other forms of tobacco, especially between the ages of 21 and 34. About half of U.S. children ages 3 to 11 are exposed to second-hand smoke. On average, smokers die more than 10 years earlier than non-smokers. You can be one of the millions of people who successfully quit every year. What makes cigarettes so toxic and dangerous? There are more than 5,000 chemical components found in cigarette smoke, and hundreds of them are harmful to human health, according to the Centers for Disease Control and Prevention. Here are a few examples. 1. 3-butadiene is a chemical used to manufacture rubber. It is considered to be a carcinogenic chemical that can cause certain blood cancers. Arsenic is used to preserve wood. Some arsenic compounds have been linked to cancer of the lung, skin, liver, and bladder. Benzene is used to manufacture other chemicals. It can cause cancer, particularly leukemia, in humans. Cadmium is a metal used to make batteries. Cadmium and cadmium compounds can cause lung cancer and have been associated with kidney and prostate cancer. Chromium Vi is used to make alloy metals, paint and dyes. Chromium Vi compounds cause lung cancer and have been associated with cancer of the nose and nasal sinuses. Formaldehyde is used to make other chemicals and resins. It is also used as a preservative. Formaldehyde causes leukemia and cancer in respiratory tissues. Polonium-210 is a radioactive element that has been shown to cause cancer in animals. Tar is not one single chemical, instead it describes several chemicals that are in tobacco smoke. It leaves a sticky, brown residue on your lungs, teeth and fingernails. Thank you for watching this video till the end. Please share, like, comment and don't forget to subscribe. As always, bonus! Carbon monoxide and nicotine, a dangerous duo. Carbon monoxide is a harmful gas you inhale when you smoke. Once in your lungs, it's transferred to your bloodstream. Carbon monoxide decreases the amount of oxygen that is carried in the red blood cells. It also increases the amount of cholesterol that is deposited into the inner lining of the arteries, which, over time, can cause the arteries to harden. This leads to heart disease, artery disease and possibly heart attack. Nicotine is a dangerous and highly addictive chemical. It can cause an increase in blood pressure, heart rate, flow of blood to the heart and a narrowing of the arteries, vessels that carry blood. Nicotine may also contribute to the hardening of the arterial walls, which in turn, may lead to a heart attack. This chemical can stay in your body for 6 to 8 hours depending on how often you smoke. Also, as with most addictive substances, there are some side effects of withdrawal. And some e-cigarettes and newer tobacco products deliver even more nicotine than traditional cigarettes. Second-hand smoke. Smokers aren't the only ones affected by tobacco smoke. Second-hand smoke and vapor is a serious health hazard for non-smokers, especially children. Non-smokers who have high blood pressure or high blood cholesterol have an even greater risk of developing heart diseases when they're exposed to second-hand smoke. Second-hand tobacco smoke contributes to thousands of premature heart disease and lung cancer deaths. Studies show that the risk of developing heart disease is about 25 to 30% higher among people exposed to environmental tobacco smoke at home or work. Second-hand smoke promotes illness too. Children of smokers have many more respiratory infections than do children of non-smokers. Please help this channel to grow by comment, share, and like. And don't forget clicking the subscriber button and bell notification. Thank you so much.